Yes?
Mr. Williams,
Mm-hmm.
can I come in? Thank you. Good morning, Mr. Williams. I'm Dr. Gogne. I'm the resident on call today.
Nice to meet you, ma'am.
Nice to meet you too. How are you in the room today? Are you comfortable?
Well, yes, thank you.
Okay. Let me just make you a bit more comfortable by spreading this drape on you.
Mm-hmm.
I'm just going to spread this on your legs. How is the temperature in the room? Is it fine?
Yes, I'm good. Thank you so much.
Okay. Well, Mr. Williams, as I said, I'm the resident on call today, and I'm here to ask you a few questions about your condition,
Mm-hmm.
and I'll conduct a brief physical examination, and then I'll be in a very good position to help you.
Mm-hmm.
So, does that sound good?
Well, that's great.
Okay. So, well, tell me, Mr. Williams, what brings you here today?
Well, Doc, I've had this nagging cough since a very long time now,
Mm-hmm.
and I just discovered some blood yesterday, so I was like really freaked out to see that. So I just thought I should come over for a visit.
Mm-hmm. Well, I can see that it must have been hard for you. It must have scared you a bit. And you did the right thing by coming to the hospital. I'm glad that you did. And now that you're here, I'm just going to try to get to the bottom of this and help you.
Mm-hmm.
Okay?
Thank you.
So we'll start by talking a little bit about the cough that you've had and the blood that you've noticed in detail. Okay? So try and remember and tell me, since how long have you had this cough?
Well, Doc, you know what? It's been nagging me since over an year now, but it's somehow gotten a bit worse in the past couple of months.
Okay.
So, and I was a bit lazy to just come over, and I thought it would just go away, but somehow it just stayed on. So
Okay.
that's the problem.
Okay. Well, I should say that you should not think that you're lazy or something. Well, these kind of things happen. But you've done the right thing to come to the hospital now. So that is the important thing now. So tell me a bit more in detail. Was this cough a dry cough, or did you also bring up secretions?
No, I think I have had some sputum that I've been coughing off, and I'd say it's been there for the past 6 to 8 months now.
Has it been increasing? Can you
Yes.
quantify it?
I think it has gotten worse in the past 6 months,
Okay.
surely.
Okay. And can you quantify it for me? Like, was it a teaspoonful or a cupful?
Well, to start with, I'd say it wasn't that troublesome. There would have been something like a couple of teaspoons, but now I feel really terrible because all the time I just whenever I cough, I get this sticky thing out, and it's about a cup now. So that's starting to worry me a bit.
Oh, well, yes, I can see that it is worrying you, and well, we'll see what is causing this. So the blood that you've noticed, was yesterday the first time that you noticed it?
That's true.
And how much blood was there in this sputum?
Well, I'd say there was
Are you on any medications for anything?
nothing right now.
Okay. Do you know of any drug allergies that you have?
Well, I think I have to check my records to be very sure, but I think I'm allergic to penicillin.
Okay. Do you remember what happens to you when you take penicillin?
I had it once, and I remember distinctly that I had an uncomfortable feeling of high fever and a bit of rash. And that is when I think I got tested for any drug allergies, and we discovered that I have an adverse reaction whenever I have penicillin.
Okay. Well, I'll definitely keep that in mind. Now I'm going to ask you certain questions about your personal health and your day-to-day habits and your family health. Again, whatever you tell me will be kept confidential. I'm just trying to be thorough here, as any of these details can have a bearing on your current condition.
Okay, great.
Okay. So, well, what kind of work do you do? Tell me about yourself.
Well, I am a nurse, and I
Nice.
work at the infectious diseases department at a hospital nearby.
Oh, okay. Well, that's very nice. So you're aware of the hospital and the surroundings that we work in.
Yes.
Okay, that's very nice. So, well, tell me more about your work. Are you exposed, as you said, you work in the infectious diseases unit. So, are you exposed a lot to communicable diseases?
Yes, pretty much, because most of the patients that we have admitted are suffering from some or the other infections, like I mentioned. So that is a part of an occupational hazard that we obviously are subject to.
Right. And do you take appropriate precautions? I'm sure that you're aware of them. Do you use respiratory protective devices like masks whenever
Yes.
you interact with
Whenever we are on call and whenever we are attending to our patients, we obviously do take the required precautions.
Have you ever been checked or treated for tuberculosis or any of the infectious respiratory illnesses?
Yes, we have our employment physicals routinely, but the last one happened about 3 years back,
Okay.
and I haven't been tested for any specific infections or tuberculosis for that matter in all this time.
Okay. Okay. Well, we'll keep that in mind. And okay, tell me a bit. You've told me about your work. Tell me a bit about your family. Whom do you live with?
Well, I got divorced about 10 years back,
Oh, I'm sorry to hear that.
and but right now I'm staying with my present girlfriend.
Okay. Okay. And how are things with you guys?
Well, they're great. Thank you so much.
Okay. Are you sexually active? If you
Yes.
don't mind me asking.
Yes, I am.
Okay. And do you make it a point to use protection all the time?
Mm-hmm.
Okay, that's very wise of you. A bit more about your family. What about your parents? Are both your parents alive?
Well, my father unfortunately expired of lung carcinoma,
Oh, I'm very
and
sorry.
you know what? This fact is something which is distinctly etched in my memory. And I remember, had a similar symptoms before we finally discovered that he had that horrible disease. You really think I could have that?
Well, firstly, let me just say I'm very sorry to hear that it must have been hard for you to lose your father to cancer. And your concern is genuine. Let me say that cancer is one of the possibilities that it can be, but right now it is too early to say anything. I'll definitely keep this in mind and I'll be testing you for it. But right now I cannot tell you definitely if you have cancer, although it is one thing that I would like to rule out. Okay.
Hopefully, it does not happen that way.
Well, let's not worry until we have to, and let's take the appropriate steps and appropriate precautions.
Mm-hmm.
Okay. Now, just a few more questions about your personal habits. Do you smoke?
Yes, I do.
Okay. How many packs a day?
Well, look, I've been smoking a pack a day since about 20 years now.
Okay. And are you aware of the ill effects of smoking?
Well, yes.
Okay. Have you ever tried to quit?
I have tried quitting it a few times, but you know what? It is just too tough. I feel that I am attached to it more than just the addiction, but I think it makes me feel better if I keep smoking, so I just haven't been able to.
Well, at this point, let me just tell you that I'm aware that smoking is a very difficult habit to give up. But smoking directly has a relation to your lungs and your respiratory system, and since you're having problems in the functioning of that system, I would strongly suggest that you consider giving up smoking.
Mm-hmm.
Is that something you can think about?
Well, I surely want to give it a try.